the concerns that have been raised by Uganda's pharmacists over the new health training reforms. Also, we shall be looking at the government's response to the Ebola-related misinformation progress in the development of the vaccine against the Bundibugyo strain, and how African scientists are using data to strengthen disease surveillance efforts, and the growing hunger and malnutrition crisis in South Sudan. So, let's get into it. Katigenda kusewali story one. Now, in our top story today, pharmacists reject health training policy demand suspension over the internship dispute. So a dispute has emerged with Uganda's healthcare training sector after the Pharmaceutical Society of Uganda, or the PSU, rejected key provisions of the newly introduced National Education and Training Policy for the Health Policy of the year 2025. Now, the policy, which was recently approved by the government, seeks to introduce internship training as part of the undergraduate Bachelor's of Pharmacy degree program. However, the Pharmaceutical Society of Uganda has expressed strong reservations, urging the policy that was developed without adequate consultation with key stakeholders in the pharmacy profession. And in the statement released on the June 1st, the society said it was not involved in discussions leading to the policy approval and therefore does not support its implementation in the current form. According to the PSU Secretary, Dr. Stephen Lutoti, the organization is concerned that integrating internship training into undergraduate studies before universities have reversed and aligned their curricula could negatively affect the quality of professional training and can potentially compromise the patient safety. Now, the society is now calling on government to suspend implementation of the policy until all university pharmacy curricula are reviewed, updated, and approved by the relevant academic and regulatory authorities. Now, PSU maintains that internship programs should continue to operate under the current established framework, where students first complete their Bachelor's of Pharmacy degree before proceeding to internship training and professional assessments. Now, the organization has also reassured that pharmacy students that there will be no immediate changes to the existing qualification process. But pre-internship examinations will continue as scheduled, and students currently in their final year should prepare for and sit these examinations according to the previously communicated timetable. Now, under the current situation, individuals seeking registration and as pharmacists, they must successfully complete a bachelor's degree, undertake a mandatory internship, and pass both pre-internship and also post-internship qualifying exams. But beyond concerns about the curriculum structure, the Pharmaceutical Society urges that Uganda's health workforce challenges are not primarily caused by the length of the training programs. Instead, it points to issues such as administration standards, supervision, institutional capacity, and working conditions as factors that require greater attention. And the society is advocating for stricter entry requirements into the pharmacy and medical training programs, saying that higher admission standards could improve the quality of future healthcare professions without increasing the training cost or extending study periods. PSU has also raised concern about the welfare of medical interns, noticing that many work long hours in critical healthcare departments while playing an essential role in parental care. Now, the organization is urging the government to improve remuneration and working conditions for interns, warning that poor welfare packages could contribute to the growing problem of health worker migration, commonly known as brain drain. Now, health sector stakeholders are expected to continue discussions on the proposed reforms as government works towards strengthening the health professional and education and addressing workforce strategies and shortages across the country at large. Now, the Pharmaceutical Society says that it remains committed to engaging with policymakers and will provide further guidance once more details about the policy implementation and the work frame that is currently available. And that's it from our story one. And moving on to our next story. Uganda pushes back against the Ebola misinformation, reporting that the government of Uganda has now raised concerns over what it describes as the inaccurate, misleading reporting about the country's Ebola situation, saying that some international organizations and media outlets have created a false implementation and impression that Uganda is experiencing a large scale of Ebola outbreaks. Now, Ugandan officials urged that some reports have combined Ebola case numbers from Uganda with those of Democratic Republic of Congo, or DRC, making it appear as though both countries are facing the same level of infection. Now, the issues gained attention after Uganda's permanent representative to the United Nations and Foreign Affairs Minister Designate Adonia Ayebale announced that African Centers for Disease Control and Prevention, commonly known as Africa CDC, had agreed to review and correct aspects of its Ebola reporting following discussions with Ugandan authorities. Now, according to Ayebale, Uganda objected the reports that merged cases figures from Uganda and the DRC, saying that such reporting does not accurately affect the situation on the ground here in Uganda. Now, health officials note that while Uganda has recorded confirmed Ebola cases, the cross-border transmission, the Ebola cases linked to the cross-border transmission, the outbreak remains much smaller than the one currently affecting the Eastern Democratic Republic of Congo. Now, officials say that most Ugandan cases have been connected to travelers and contacts linked to the regional outbreak rather than the spread of community transmission within the country at large. Now, the government has emphasized that Uganda remains vigilant and that public health teams continue to actively monitor the contacts and also conduct surveillance and implement containment measures to prevent the further spread of this virus. Now, the executive director of Uganda Media Center, Alan Kasuja, said inaccurate reporting risks causing unnecessary fear that could negatively affect key sectors of the economy. This includes tourism, trade, investment, and regional business activities. Now, government spokesperson has also urged journalists, development partners, and members of the public to rely on official updates issued by the Ministry of Health when reporting on or discussing the Ebola situation in Uganda. Now, ICT and National Guidance Minister Designate Justin Kasule Lumumba stated that health authorities have identified and are monitoring all known contacts associated with the confirmed Ebola cases. She stressed that Uganda's response system remains active and that the country continues to benefit from the decades of experience managing outbreaks of Ebola, Marburg, and other infectious diseases. Over the years, Uganda has built a strong reputation in disease surveillance and laboratory testing, contact tracing, and outbreak containment, allowing health authorities to respond quickly whenever cases are detected. Meanwhile, Uganda's engagement with the CDC has also resulted in positive developments for regional public health cooperation. Now, according to Ayebale, Africa CDC plans to establish a regional pandemic preparedness and response center in Uganda. The proposed facility is expected to strengthen disease surveillance and emergency response capabilities and regional congressional across East Africa. Now, public health experts say that strong partnership and accurate communication are critical during disease outbreaks. They also emphasize that timely and factual information helps prevent panic and supports public confidence and enables communities to take appropriate preventative measures. And health officials continue monitoring the Ebola situation. Ugandans are being encouraged to follow Ministry of Health guidance, practice good hygiene, report symptoms early, and seek information from the trusted and verified sources. And that's it from our second story for today. Now, moving on to our third story for today. Now, Moderna and other groups get $60 million to develop the Ebola vaccine. Now, global efforts continue to combat the ongoing Ebola outbreak in Central and Eastern Africa and have received a major boost after international health partners announced a new funding worth approximately $60 million to accelerate the development of vaccines against the Bundibugyo strain of the Ebola virus. Now, the funding has been approved by the Coalition of Epidemic Preparedness Innovations, commonly known as CEPI, and will support vaccine development projects led by biotechnology company Moderna, the University of Oxford, the Serum Institute of India, and the International AIDS Vaccine Initiative, or IVI. Now, the investment comes as health authorities continue to battle a growing outbreak of Bundibugyo Ebola in the Democratic Republic of Congo, with cases confirmed here, reported in Uganda. Now, the World Health Organization has described the situation as a major public health concern and has emphasized the urgent need for effective vaccines and treatments. Unlike some other strains of Ebola, the Bundibugyo strain has currently no approved vaccine and no specific licensed treatment. This has made controlling the outbreak particularly challenging for health workers on front lines, and the largest share of funding, up to $50 million, has been allocated to Moderna to support laboratory research, manufacturing, and also early-stage clinical testing of all on experimental vaccine candidate based on the company's mRNA technology. Now, scientists hope that the vaccine could provide strong protection against the Bundibugyo virus while being easier to deploy during the outbreaks. Additional funding of approximately $8.2 million will support a vaccine being developed by the University of Oxford in partnership with the Serum Institute of India, while more than $3 million has been allocated to the International AIDS Vaccine Initiative to advance another promising vaccine candidate. Health experts say that the funding will help speed up research and ensure that vaccine candidates can move into clinical trials much faster than would normally be possible. Now, the goal is to have safe and effective vaccines available, and should the outbreak continue to expand to other areas. Now, according to the World Health Organization, the Bundibugyo outbreak has become one of the largest outbreaks ever recorded for this particular strain of Ebola, and public health officials warn that continued transmission could go beyond borders, and highlights the need for stronger regional preparedness and faster access to medical countermeasures. Now, the measurement has been welcomed by the global health experts, who say that vaccine development remains one of the most important tools for preventing further Ebola outbreaks and protecting healthcare workers, communities, and also the vulnerable populations at large. And as scientists race to develop a new vaccine, health authorities continue to encourage the public to follow Ebola prevention measures, report symptoms early, and also cooperate with surveillance and contact tracing efforts. Now, this new funding offers hope and that the initiative can become effective and can protect against the Bundibugyo strain, and may soon become available, strengthening the world's ability to respond to one of the most dangerous infectious diseases known to the whole of humanity. Now moving on to our next story here on TV1. African scientists have sharpened data tools to tackle women's disease outbreaks. And African scientists are now strengthening their use of data science and mathematical modeling to improve responses to disease outbreaks and address one of the containment and most pressing health challenges, particularly those affecting women and vulnerable populations at large. Now, the development was highlighted during a third summer school of the African Modeling and Analytics Academy for Women, commonly known as AMAX, held in Nairobi, Kenya. Now, the initiative brings together scientists and researchers from across Africa to build expertise in data analysis, disease forecasting, and public health decision-making. Experts say that mathematical modeling has become an essential tool in modern public health, and by analyzing large amounts of health data, scientists can predict how diseases are likely to spread, identify communities at high risk, evaluate vaccine strategies, and estimate what resources and hospitals and also healthcare systems may need during any outbreak. Now, the approach gained global attention during COVID-19 pandemic when governments relied heavily on scientific models to guide decisions on lockdowns, vaccination campaigns, and healthcare planning. Researchers involved in the AMAX initiative say Africa must continue building its own scientific capacity so that health policies are based on local evidence than realities faced by African communities. And one of the program's major goals is to address gaps in women's health data. And scientists note that many health studies have historically underrepresented women, making it more difficult for policymakers to fully understand and respond to health issues that disproportionately affect women and girls at large. Current research efforts within the network are focusing on several major public health concerns, including human papillomavirus, commonly known as HPV, hepatitis B, COVID-19, antimicrobial resistance, and schistosomiasis, commonly known as bilharzia. These are the diseases and conditions that continue to affect millions of people across Africa. And according to researchers and strong data systems and better forecasting tools, according to the researchers, like the strong data systems and better forecasting tools can help governments and to make more informed decisions about vaccine distribution, disease prevention programs, healthcare spending, and emergency response planning. And Uganda is among the countries participating in this initiative through researchers from Mbarara University of Science and Technology, and Ugandan scientists are collaborating with regional and international partners on studies examining antimicrobial resistance and other emerging health threats. Now, the program also showcases how scientific data can influence public health policy. In one example, researchers in Kenya and in Senegal use modeling technologies and techniques to evaluate strategies for controlling schistosomiasis and recommended expanding treatment programs to include children under 5 of age. Health experts say that strengthening local research capacity is critical as Africa continues to face challenges such as infectious disease outbreaks, climate-related health threats, and growing antimicrobial resistance, where medicines become less effective against infections. They highly believe that investing in African scientists, data systems, and research institutions will improve outbreak preparedness, strengthen healthcare systems, and ultimately save lives across the continent. As health challenges become increasingly complex, experts say that evidence-based decision-making powered by local data will play an essential role in protecting communities and improving health outcomes for future generations to come at large. And moving on to our final story for today. Now, the World Food Programme scales up emergency response in South Sudan as catastrophic hunger and malnutrition deepen. Now, the United Nations World Food Programme, commonly known as WFP, has significantly expanded its emergency humanitarian response in South Sudan as hunger and malnutrition reach alarming levels in parts of the country. Now, the agency says that hundreds of thousands of people in Akobo East, located in South Sudan, are facing severe food shortages, with some communities now experiencing catastrophic levels of hunger. And according to the latest Integrated Food Security Phase Classification, or IPC, report, parts of Akobo country have entered phase 5, commonly known as catastrophe, and at the highest level of food insecurity before famine is officially declared. Now, the report estimates that approximately 12,000 people are currently facing catastrophic hunger, while another 85,000 are experiencing emergency level of food insecurity, and nearly 97,000 additional people are struggling to access enough food and are classified as being in a crisis condition. Now, health experts are warning of a worsening malnutrition emergency, particularly among children under 5 and pregnant women, plus also breastfeeding mothers. And the situation has been fueled by the ongoing conflict, mass displacement, disease outbreaks, and the collapse of local food markets. Humanitarian agencies report that more than 142,000 people have been displaced from Akobo country and surrounding areas, while approximately 100,000 others have fled across the border into the neighboring Ethiopia. Now, the World Food Programme says that severe malnutrition among young children is raising rapidly increasing fears that famine-like conditions could develop if urgent assistance is not sustained. In the response, WFP has intensified food and nutrition support operations across the region. And over the past 3 weeks, the agency has reached more than 60,000 vulnerable people with emergency food assistance and nutritional support. And among those assisted are over 15,000 people who received the emergency food supplies, and nearly 6,000 people and breastfeeding women who received nutritional supplements, and more than 30,000 displaced people who were provided with high energy biscuits, and important source of nutrition for people on the move. And in addition, more than 6,000 children and mothers have received specialized nutritional foods through supplementary feeding programs. And humanitarian teams have also conducted a nutrition screening for approximately 15,000 children and identified more than 3,000 children suffering from moderate acute malnutrition who are now receiving treatment and support. Now, delivering aid remains extremely challenging in these areas, plus persistent insecurity and damaged infrastructure, and the onset of the rainy season has made many roads difficult and impossible to use. As a result, the World Food Programme has relied heavily on constantly air operations to transport food and medical supplies into the affected communities. Now, the organization reports that more than 60 humanitarian flights have already been conducted, delivering to hundreds of metric tons of food and nutritional supplies and emergency relief items to hard-to-reach areas. Now, the convoy of 33 trucks carrying food and humanitarian supplies is also expected to arrive in Akobo. However, aid agencies warn that this could be the final major road convoy before seasonal rains make key transportation routes impassable. Now, WFP Country Director in South Sudan, Mutita Chimuka, says that the situation remains critical and requires immediate action to save lives. She also emphasized that humanitarian workers must be guaranteed safe, secure access to other affected communities so that life-saving assistance can continue reaching those in the desperate need. Now, the agency is also expressing concern about thousands of vulnerable people trapped in remote areas where hunger and malnutrition are expected to worsen in the coming months. To sustain this operation throughout 2026, the World Food Programme says that it urgently requires $266 million to continue providing food assistance, nutritional support, and also logistical services to communities affected by the conflict and hunger across South Sudan. Humanitarian organizations continue to call for peace, improved access to affected populations, and to prevent further loss of life, and to help communities recover from one of the region's most severe food crises. And to our dears, that is our story for today, but let's first take a look at what really happened in South Sudan, Kobo area.
(62) to call again 1. You clear to drop. Papa India Romeo.
My name is Blessing Zambo. I'm a logistics officer currently based in Bo, supporting WFP Logistics with dry season pre-positioning. A very unique operation in the sense that we only have a very tight window to pre-position the food by road. In total, we are looking at moving around 1,875 trucks to meet the total requirements for both Northern Jonglei and Pibo areas. This food that we are sending is food that is going to be consumed across the entire year from January to December. It also involves our general food distribution activities, nutrition activities, and direct distribution. The departure times are normally 6 a.m., but the trucks start lining up at around 4:30 a.m. in the morning. So for tomorrow, we are looking at around 45 commercial trucks, plus 5 WFP fleet trucks, which will be used as rescue trucks. We are looking at covering a distance of about 215 kilometers, that is from Bo all the way to Pibo, and this should take close to a full day.
This is one of the most isolated parts of South Sudan with only one road that leads here. And each rainy season that road goes underwater, leaving it even more isolated and vulnerable. But what we're seeing here today is the result of what happens if we're unable to pre-position. And the only way that we've been able to get food assistance here is by airdropping it in.
My name is Sean Bruss. I am the tasking officer for WFP Logistics through UNHAS, and I specialize mostly in airdrops. What we do is we have to identify an area that is close to a distribution center, and generally we will have the targeting teams identify the locations, then our technical teams will come out, measure out the drop zones. Requirements for the drop zone for the type of aircraft that we use have to be 800 by 200 with a security area of 200 meters around the drop zone.
We are just telling them to clear the drop zone so that we don't have people or animals in the drop zone, because we are expecting the flight in another 10 minutes. 0801, copy that. Thank you very much. We are ready.
Before every airdrop, I do get nervous, simply because there's a lot that can go wrong. During the actual job, there could be heavy winds which could shift the bags outside of the drop zone. So there's a lot of unknowns that can come up during a drop. So they left at 9 o'clock, so maybe 10 o'clock.
6-2, that was a beautiful one. Same spot, call again 5.
We are now here at the issuance point. We have beneficiaries now trying to get their food. This lady is being targeted under this particular food assistance program. She's a returnee who just came recently from Khartoum. So she's getting the food on behalf of other household members. There are 4 households that will benefit from this food. That is 10 bags and 1 of pulses. So once she gets the food out to the sharing area, she would then call the other 3 households, then they will be able to share the food among themselves.
I love the job because I've realized that I'm also part of a tool which is bringing help to people. So I know I'm part of the belt which brings support, which brings relief to people who are not able to support themselves. 6-2, Roger. That was another beautiful one. Call again, inspection complete.
Today we are in Akobo town at the airdrop site in the south of UNMISS compound in the outskirts of Akobo town. We've received 55 metric tons of pulses and cereals by airdrop. We have also transported from the UNMISS warehouse 4 different commodities, oil, salt, CSB Plus and Clampidos, to make sure that the vulnerable group of people who've been targeted for this assistance receive the full food basket. So we'll continue to operate this operation for the coming couple of days. In the meantime, we are also expecting a convoy coming from Bor with over 200 metric tons of different assorted food commodities. I would like to take this opportunity to thank several of our donors who've supported us to support the people who are in dire need of humanitarian assistance. Without the donors' support, this response wouldn't happen.
So that brings us to the end of today's health program and news updates. So we've highlighted the importance of the development in public health, also disease prevention, medical research, mental health and humanitarian response from Uganda and around the world. So as always, staying informed is one of the most powerful tools we have in protecting our health and the well-being of our communities at large. So remember to follow guidance from the health professionals, seek medical attention and when necessary, and continue practicing health habits that keep you and your loved ones safe. So thank you for joining us today in your health show. Let's meet again tomorrow. Stay informed, stay healthy, and have a wonderful day. Goodbye for now.